Lung cancer is one of the deadliest cancer types, responsible for over 150,000 deaths each year in the US alone. Over 234,000 new cases are diagnosed annually. Unfortunately, lung cancer is a stealthy disease that too often evades early detection, as symptoms frequently don't arise until advanced stages once it has spread. But being vigilant for subtle changes and recognizing key early warning signs is absolutely crucial for getting screened in time and catching lung cancer in initial localized stages when outcomes are vastly improved with prompt treatment. In today's very comprehensive video, I'll be providing an in-depth look at the top 10 early symptoms of lung cancer that you must be aware of. Make sure to watch until the end, because these vague clues are your body's way of signaling emerging malignancy. Okay, let's dive in. Symptom number 1: persistent cough. A persistent cough that lingers for weeks and won't go away is one of the most common early tip-offs of lung cancer. While there are certainly other causes of chronic coughs like allergies and asthma, this key symptom is present in the majority of lung cancer patients. Coughing is often one of the first lung cancer clues because as tumors expand and obstruct airways, the body tries to expel them by coughing. See your doctor for imaging tests if a stubborn cough persists, especially when combined with other symptoms. Symptom number 2: coughing up blood. Coughing up blood, known medically as hemoptysis, can also indicate lung cancer if the expanding tumors rupture blood vessels lining the airways. Coughing up blood-tinged sputum or frank blood merits prompt investigation. While alarming, hemoptysis can also stem from lung infections, bronchitis, trauma or blood clotting disorders. Regardless, recurrent coughing up blood warrants immediate medical attention to discover the root cause through scopes and imaging tests. Symptom number 3: unexplained weight loss. Unintended significant weight loss with no changes in diet or exercise habits is a cardinal early sign of several cancer types, including lung cancer. Weight loss often signals malignancy is present and active. As lung tumors grow rapidly, their accelerated metabolism places huge demands on the body for nutrients and oxygen to fuel growth. This cancer cachexia leads to ongoing loss of weight and muscle mass. Symptom number 4: shortness of breath. Difficulty catching your breath and increased shortness of breath are also common lung cancer harbingers. Over 70% of patients report breathing issues, from airway inflammation to fluid accumulation collapsing parts of the lungs. Tumors obstructing airways also contribute to increased breathlessness. Gradual onset of breathing difficulty with no other explainable cause warrants prompt medical assessment. Symptom number 5: chronic fatigue. Excessive fatigue from lung cancer stems from inadequate oxygen circulating throughout the bloodstream as tumors expand in the lungs, hampering breathing. This can manifest long before other symptoms arise. Debilitating fatigue also results from the immune system's hyperactivation in response to cancer cells. In addition, poor nutrition and emotional stress worsen fatigue. Symptom number 6: hoarse, raspy voice. A hoarse, raspy voice that fails to improve can signal a lung tumor pressing on the laryngeal nerve that controls vocal cord movement. Hoarseness often arises with voice overuse. But if you notice your voice becoming increasingly hoarse for over 2 weeks with no cold, allergies or overuse explaining it, consult your doctor for a laryngoscopy to inspect for tumors impinging the larynx. Symptom number 7: chest pain. Chest pain or discomfort is another common early lung cancer clue, resulting from tumors compressing chest structures like the lungs, ribs, chest wall and lining. Pain may worsen with laughing, deep breathing or coughing. Lung cancer spreading to the spine or ribs also generates bone pain. Tell your doctor about any chest pains, especially when combined with breathing trouble or chronic coughs. Symptom number 8: loss of appetite. Appetite loss afflicts a majority of lung cancer patients as malignancy progresses. This links to metabolic dysregulation as cancer cells alter appetite hormone signals. Nausea and fatigue also suppress appetite. If you notice you no longer feel hungry or food seems unappealing for weeks, accompanied by gradual weight loss, talk to your doctor to identify potential causes like lung cancer. Symptom number 9: night sweats. Drenching night sweats that soak your bedsheets can provide an early clue of lung cancer. As cancer cells multiply, hormonal changes prompt flushing and sweating episodes. Make an appointment if night sweats are recurring and unexplained. Blood tests help determine if an occult cancer could be driving night sweats. Symptom number 10: recurrent lung infections. Finally, since accumulating cancer cells weaken immunity, frequent bouts of bronchitis, pneumonia and other lung infections could indicate lung cancer's presence. See your doctor if you notice recurrent infections in the lungs or airways that seem resistant to antibiotic treatment and just won't fully resolve. That covers the major early warning signs of lung cancer to be vigilant about. Listen to subtle body changes, and always report persistent symptoms to your doctor like chronic coughs, appetite shifts, unexplained weight loss, fatigue and breathing changes. Early detection saves lives. Let me know if you have any other questions about lung cancer screening or symptoms. Wishing you perfect respiratory health.